When my mom was diagnosed with cancer, I remember going with her to her oncologist's office, and he asked her how she was doing. She told him she was tired and having trouble getting up the stairs and feeding herself, and not surprising, he asked her if she had anyone to help her at home. She replied that she had 3 adult daughters in town, to which he smiled and looked at me approvingly. What he didn't know was that 2 of us are estranged, and another sister's husband had just had a debilitating stroke and was in the ICU at that time. In fact, this was the first time I was hearing my mom talk about this, and there was really no care coordination happening for her. And because of this, she made some poor health decisions that impacted her health outcome and her mortality. You see, her doctor did not know to ask the next question. Could she trust her daughters to help her if she needed it? And did she depend on them? You see, my mom was suffering from adverse social connectedness, one of the most invisible social determinants of health, a factor that results in poor health outcomes for many women facing cancer. But it's not just cancer. You see, we're all embedded in social support networks, and yet they are largely invisible, not only to ourselves, but also to the people trying to care for us. And the problem is that providers do not have the tools they need to adequately screen and track patients to understand who is at greater risk and provide whole person care. I'm Dr. Danielle Varda, CEO of Visible Network Labs. I'm a tenured professor at the University of Colorado and the mother of 3 spirited girls. I'm a network scientist who's been studying the link between social connectedness and health outcomes for almost 20 years, and even I didn't see this problem that my mother was struggling with. We started Visible Network Labs with one goal in mind: to make these invisible networks visible. We've done years of research and took all that experience and knowledge and created PARTNERme, our proprietary HIPAA-compliant platform that collects and visualizes networked connections and turns them into insights. So let me show you how it works. PARTNERme provides an evidence-based screener that a patient like my mom would complete either on intake or from the comfort and safety of her own home. In about 5 minutes, the patient answers a few questions about their own health, loneliness, and other questions. And they are prompted to identify who provides social support and whether they can trust and depend on these people, and if those people can coordinate care for them. We can quickly see who is embedded in a coordinated network of care and who's not. After identifying the things that they're struggling with, our algorithms use their answers to create visualizations and scores. They're prompted to swipe a connection between their needs and any help they already have, which means we can identify their most pressing need with the least amount of social support to provide a person-centered, targeted resource referral. By leveraging the personal assets they bring to their care, we can increase the chance of successful follow-through. When done, the provider gets a report of results and scores to benchmark their levels of trust, dependency, and risk of adverse social connectedness. In turn, the patient gets a personalized list of resources and follow-throughs tracked on subsequent visits. PARTNERme is modular, so any resource list can be imported, connected to a public database, or linked to through an API. But there's a little more. Every time a patient is screened, this creates another data point to inform the entire system of connections between providers, payers, resources, and patients, providing population-level data. We track trends against health outcomes and financial data to determine the ROI and cost savings of using this approach. Can you imagine if we knew this kind of data and information about patients and whole populations? I believe someone like my mom would have been flagged as high risk when it really mattered. All this takes a lot of strong evidence and a research base to provide and to prove and support. Our data science team are busy doing the analytics necessary to link medical records to social connectedness to financial data. We're seeing positive results across all quality measures. And of course, the big question is, who pays for this? We're ideal for value-based care models with innovative payment incentives and social needs billable codes. Our at-home self-assessment provides additional behavioral health and primary care touch points for telehealth. Our current users pay a monthly subscription, and we have grant support from major foundations like the Robert Wood Johnson Foundation and Bill and Melinda Gates, public health and health systems, and government and private entities. Ultimately, we want to prove out the ROI and cost savings to justify a PM-PM model. Of course, our ideal customers are large health systems that will help us scale our solution, but our roots are in social service agencies, clinics, home visitation programs, and even schools. And my favorite user has been my own daughter here and other kids who use PARTNERme as a new way to talk about their mental and behavioral health needs. So currently we have 3 pilots in Colorado. One is with the CU School of Public Health to screen patients in early childhood centers on their ACEs and social support in southern Colorado. The second is with the Rocky Mountain MyRec VA, where PARTNERme was just deployed to veterans across the Rocky Mountain region to identify those at risk of social isolation, loneliness, and depression as a result of the COVID pandemic. And finally, with funding from the Community First Foundation and in partnership with Dr. Ayelet Talmi at the Children's Hospital, we're piloting PARTNERme in 2 integrated pediatric care clinics to assess social needs and connect families with resources. We would love to expand our partnerships and pilots with Social Health Information Exchange and RAISE as ideal clients. We're great partners and can design affordable pilots for populations and needs for your organization. My partners in this work are a team of the nation's best network scientists, developers, and communicators. We have advisors in policy, medicine, entrepreneurship, and business building. And our partners range across the sectors and now the globe. 7 years after my mom died, social connectedness persists as a problem for my family and likely for families like yours. COVID has exacerbated the issue, and loneliness and adverse social connectedness is as high as it's been in decades. My hope is that one day my 3 spirited girls will be able to take for granted that social support is part of their health care. My team and I are committed to a future where no one is left without the social support they need. I hope that you'll join us. Thank you.